Well, good afternoon, everyone. Thanks for joining us. We've got a few things to cover with you today. They include some updates on communications. We've got 3 guidance documents to go over with you. One on decisions regarding promotion and retention of students. Second, around operating schools after vaccination has occurred. And finally, we have to talk about the new CRRSA, CRRSA funding that's coming into the state that'll be distributed to schools. Some of it we have at the Department of Education, and some of it is going through the governor's office, but we'll talk some about how those funds can be used and some guidance around that. We'll have some time for questions and answers, and then we'll finish up talking about a special superintendent webcast that we'll hold on February 23rd and some requests that we have from you around that. So I want to turn things over to Tony Constatman right now to cover the communications updates. Go ahead, Tony.
All right. Can you hear me? Okay, I'm just making sure.
We can.
Okay, perfect. All right, so the first thing I want to kick off is to let you know that we have announced that Dr. Glass will be having a commissioner's listening tour that is going to kick off April 6th through May 9th. We announced this last week through media and through public, through our press release system. And this is to gather input on our long-term aspirations for our education system. We're going to be holding 9 sessions across the state, 1 in each cooperative region. The great thing about these being virtual is that you do not have to leave your house. So even if you are in Louisville and want to attend the one in Bowling Green, you can do so, and vice versa. You can go to our website to register, pre-register for these. These are going to be quite different than any other town hall / listening tours that you have seen from the department before. We're going to do them kind of in a breakout room type session where they're going to be student-led, paired with a Team KDE member, and lots of kind of empathy-based questions so that we can, build our kind of Dr. Glass can build his, a vision for the department and the Board of Education based on answers that we receive from the feedback sessions. So please, if you can join us for any of these sessions, we ask that you spread the word around your districts, around your area, and have them pre-register for these slots so we know how many to expect. We would like to keep the breakout rooms to about 15 to 20 apiece so we can have a great conversation. And more information on this tour is on our website. Commissioner, did you want to add anything about the listening tour?
Well, really the purpose of it is to gather information and aspirations from educators and students and citizens in Kentucky about what our future hopes and dreams are for what school could be going forward. We hope that this culminates into some kind of statewide event that we will be working on for the fall, and also results in a vision document that we can turn into a legislative proposal, something big, something at a large scale to think about what the future of education could be in Kentucky. So I encourage folks to be part of it, encourage your staff to be part of it, and also encourage your community to be part of it. I think what's going to emerge is a positive and exciting vision for the future of the Commonwealth. And if we really build it based on what the people in Kentucky have told us, it's going to be really hard to argue with that that's the direction we need to take going forward. So the more input we can get on that, the better. Thanks, Tony.
Great. Next, just want to let you know, we announced this one today. The nominations are open for the Kentucky Board of Education's David Karam Award, obviously named for our former Kentucky Board of Education chairman. And this recognizes a state policymaker, education leader who has made notable statewide contributions to improvement of our education system. Nominations are open through the 17th, and we are hoping that you will submit somebody who meets this criteria. And once again, sent that out via our social media, news releases, and more information is on our website. Nominations for Teacher of the Year are open through the 20th. I believe we have about 500 nominations right now. So looking to get more of those. Again, the only way that you can become a Teacher of the Year is for someone to nominate you. So we are looking for lots of nominations. Once somebody is nominated, they will have to fill out a lengthy application, but it's really, really important to get that nomination first. So please, 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 if you know an outstanding teacher in Kentucky, and we know we have thousands of them, to nominate them from your area. And that is it. I will kick this off to our next agenda item, to Mickey Ray and Misty Higgins.
Thank you so much, Tony. We're happy to be here with you today. The guidance document that you will see entitled Decisions Regarding Promotion and Retention, it was created in response to feedback around local concerns about making those decisions appropriately. And as we know, the Kentucky Department of Education, we're sensitive to the fact that this period of extended hybrid and remote learning resulting from the COVID-19 emergency, it does present many challenges that are not evident in traditional in-person classroom instruction. We know that considerations must be made to address both the social and emotional learning and academic transition and success goals, as those learning gaps or other issues triggered from extended hybrid and remote learning do not automatically trigger retention. And I guess the overarching goal before we get into the framework is that these final decisions as to promotion or retention really do rest with local school authorities, and that's established in KRS 158.140, but no student should be retained without prior family engagement. And so in thinking about making these decisions, regarding both promotion and retention, we wanted to pull from the multi-tiered system of support framework. And so we know that we'll be utilizing a system for early identification of students who are chronically absent or who may be at risk. We'll need to analyze student data to look for the root causes of absenteeism and or the barriers to attendance or to their learning. We want to implement and monitor tiered interventions prior to any retention, serve students in an environment that best meets individual student needs, but also plan for targeted interventions that may be needed in both the spring to accelerate student learning to even avoid the need for that retention. And then lastly, considering we are also talking about ESSER II funding, we should consider how we might utilize those funds to support students who are needing accelerated learning, both in the spring and then into the summer and the fall as well. Next. Within the document, we also have local considerations. And so I just want to spotlight 3 here because they relate to some of the guidance and support that we have embedded into the document. The first one, how is the formative assessment process being utilized in Tier 1 classroom instruction to monitor student learning in the in-person, hybrid, and/or remote learning environment? So we know that systems have to be in place to be able to collect that data and analyze it effectively to identify student needs. And then I also want to spotlight the last 2. So what steps can be taken again in the spring and summer to support students who may be at risk of being retained? And then if students are not retained, what system will be in place in the fall of 2021 to support successful student transition? And then the next slide. So I'm going to transition to Misty Higgins. She's the Professional Learning Coordinator in the Division of Program Standards. So Misty, if you will talk about those resources for us.
Yeah, we just wanted to share with you all some resources that we have available to support you around this idea of classroom instruction, assessment, as well as with interventions. And the first one is the MTSS FAQ that we have compiled. And this one really addresses some of the most commonly asked questions that we have received around how to implement MTSS during remote and hybrid learning. It really focuses on ways that we can support students' academic and social emotional behavior needs through our core instruction, assessment, and through interventions. The second resource is that you see on there. This is our current online book study that we are offering. It's focusing on the assessment playbook for distance and blended learning. And the reason that we selected this text, it was based on feedback we had received from teachers and leaders who really needed some assistance on how do we effectively assess student learning in the distance learning setting. And so this book provides teachers with assessment tools that they can use for multiple assessment purposes, from things like universal responses in the distance learning setting, using teach back opportunities, as well as how we can can do self and peer assessment in the distance learning setting. And then even more importantly, this study focuses on how teachers then use that information to determine the impact of their teaching to help inform next instructional steps. This study actually just started last week. Registration, anyone is still welcome to register for it. It does run through the end of April, and at the end of the study, we will package it and make it available in case anyone would want to lead someone through their school or district in this particular study. But the link that you see here for the assessment playbook, it would take you to a page where you could register for the study. So please feel free to pass that on to even colleagues you think would be interested in joining. The next two resources are previous online book studies that we have packaged into a learning plan that anyone could use to facilitate the studies back at their school or district. The first one, the Distance Learning Playbook, this is actually the study that we did this past fall, and that particular text is looking at instruction in the distance learning setting. And we know that in order for students to be successful, we have to couple strong instruction with sound assessment practices. So that text takes a closer look at the evidence-based practices that we know are critical for student success in any setting and how we can transfer and utilize those in the distance learning setting. Now, the other packaged learning plan that you see is based on a companion book that was released called the Distance Learning Playbook for School Leaders. And this particular text is a hands-on guide that's focused on leading schools through distance learning by using what we know works best to accelerate student learning while maintaining that focus on equity. It includes topics that range from school climate at a distance, leader credibility, instructional leadership teams, as well as maintaining virtual visibility. And then the final two resources that you see are a part of our professional learning series this school year that's focused on balanced assessment, specifically the formative assessment process. These modules were designed to build a deeper understanding of what formative assessment is, what we mean by the formative assessment process, and what are strategies that we can utilize to elicit evidence of student learning in any setting. The fall series consisted of 4 asynchronous modules, and each includes a PowerPoint and a facilitator's guide. So again, you could pick up that facilitator's guide and lead any group through that learning. As a continuation of the fall series, our spring series is focused on interpreting and acting on evidence of student learning. So not just the teacher interpreting and acting on that evidence, but how can we empower our students to interpret and act on evidence of their own learning? The thing that is different about our spring series is that for each module we release, there will be a content-specific version available for reading and writing, for mathematics, social studies, and science. All of the resources that you all see on this page are available on KY Standards, except for the MTSS FAQ. But again, when you get access to this PowerPoint, those are all live links for you.
Okay, thanks, Mickey and Misty. Appreciate that. We're going to go over to Kelly Foster, and I think we have Dr. White on with us as well to talk about operating schools after vaccination. So this is going to be one of those issues that we have to continue to manage. Just because we have a large-scale distribution of vaccines, and we're grateful to the Department of Public Health and the governor for prioritizing our educators in the vaccination process, that doesn't mean that things automatically snap back to normal. And that may be one of the expectations we have to manage with our community and with our students and staff to make sure that we continue with the virus mitigation strategies that we've been using up to this point. Things will be safer, but we're not out of the woods yet. So I'll turn things over to Kelly and Dr. White now.
Thank you, Dr. Glass. You actually took my first 3 slides, so I think we can just move on. No, next slide, please. Everything Dr. Glass said is 100% accurate, and what we kind of wanted to reiterate today, and why I asked Dr. White to tag team this with me from Public Health. But looking at the guidance that was released yesterday around life after vaccines, and I know many of you all are in that process, just one thing that we really need to keep in mind moving forward is that the Healthy at Schools document still stands. And so the expectations in the Healthy at Schools document, the social distancing, the cloth face coverings, the school health policies and PPE, the screening and the school exclusion, the sanitation and environmental factors, and the contact tracing, those are those 5 expectations in Healthy at Schools that you all really need to continue to implement the best ways possible in your building. And so if you need another look at Healthy at Schools, you can find that if you go to Katie's webpage, and at the top, click on COVID-19, and you will see the Healthy at Schools document. And the most recent one that is posted has the updated date of December the 7th. So just keep in mind as you all are continuing to open in hybrid models and hopefully different models moving forward after everyone is vaccinated, that Healthy at School still stands. Next slide, please. Considerations for remote work. There is a section in this guidance document that we released yesterday that reiterates everything that has been said about remote work before. This is not new information, but we felt like we needed to reference it again because we were receiving lots of questions about remote work and vaccines, and if someone is offered a vaccine and they turn down the vaccine. So let's take a second and look at some highlights of Executive Order 2020-1041. That is the executive order that lists what is eligible for accommodation. And so you've seen those many times before. The second piece of that that's in the executive order talks about the requirement to offer the requirement to offer accommodations extends until the eligible employee is at least 7 calendar days past the final dose of the complete vaccination series for the applicable vaccine. Districts are not required to extend accommodations to employees who refuse to take the vaccine. And so I know our legal office has received some questions about that. Our COVID-19 mailbox has received some questions. And so, Tony, at this time, I'd like to share my screen just a second.
Sure. Okay.
Can you see it?
I believe so.
So this is the guidance document that was released yesterday. And if you go to our webpage right now, you will see the document that says February 8th. So one of the things that we did last night, just to make this a little clearer to you, is we updated this guidance. And what you see in yellow is the updated piece. After the webcast today, the guidance dated February 9th will be uploaded to the webpage, the COVID-19 webpage, and this new version of the guidance will also go out with the PowerPoint slides for today. And so basically, I've worked with our general counsel, Todd Allen, to just insert some additional information in here. You have seen this before. It comes straight from the EO, but it will just help you as you are determining the remote work and what needs to happen for employees that did not take the vaccine and who is still eligible under the Americans with Disability Act for accommodation. So we updated this just a little bit. That way you wouldn't have to continue to reach out, that you would have it in the guidance document. So just wanted to point that out to you all. And once again, it'll be updated on the webpage after the webcast today, and you will get the updated guidance document sent to you in an email. Thank you. Next slide, please.
Okay, give me one moment. Let me know when you can see that again. Oh, I lost it. Give me 1 second here.
No problem.
I don't know where it went. Oh, wrong one. That is not what I want.
And I can go ahead and kind of start talking about the next slide as Tony is pulling that back up. But the next slide deals with quarantine procedures. And I asked Dr. White to join me on this slide so we could talk a little bit together about this. The slide is going to reference the CDC recommending that vaccinated individuals continue to follow the established quarantine protocols after an exposure to someone with COVID-19. So I think the situation that you guys are under and a lot of questions that we've been hearing is, well, what happens if one of our employees has had their first shot and then they're exposed to someone with a COVID-19, and what happens after they've had their second vaccination and they are then exposed to someone with COVID-19. So, Dr. White, if you could kind of pop in and walk us through the information in this slide and why the quarantine still plays a role, even if you've had one vaccination or even two vaccinations.
Thank you, Dr. Foster. This is real important. I know we've talked about this, but I want to go through it a little bit more in detail to be sure everyone is clear. One of the things that normally happens when a vaccine is studied for release is the people that are receiving the vaccine are checked to see if they have severe illness or hospitalization or even have death from the infection that we're trying to prevent. We were able to show that with the Operation Warp Speed work that showed that the two vaccines that are now allowed in the United States had a 95-96% efficacy to keep you from having a severe illness, to keep you from being hospitalized or death. What that study did not have time to show, which normally you would study that vaccine for practically a year, is they would watch to see if people actually get infected with the COVID-19 virus. Because of the urgency of preventing severe illness and death, those vaccines were released for us to use. So the data as to whether if I get the vaccine series, will I be able to catch COVID-19? We don't have that data right now to the ability that we can tell you for sure that you are immune from getting this virus, this infection. What we can tell you is preliminary data is looking very good, but we have to right now work under the understanding that we have very good clarity that these two vaccines will prevent severe illness, hospitalizations, and death. Excuse me. Sorry. But we do not have the data that shows us about infectivity. So if I have been vaccinated, I'm exposed to COVID-19, we do not have data to show that I cannot get infected. I could get a mild reaction to COVID-19, or I could be asymptomatic. If I'm infected with COVID-19, I could then spread the virus. So we are being, for the caution of preventing that kind of spread, even if you have gone through the vaccination series, you have done a great job to protect yourself from illness. You've done a great job from severe and illness or death. And we think from the data we're seeing, if you have an infection, it'll be very mild. The milder the infection, the less likely you are to spread that. Do you think that covers what you're looking for, Kelly, or do you want me to go through the quarantine procedures here that are listed?
If you don't care, would you please just take a moment and go through
Sure.
those quarantine procedures?
Well, the CDC ultimately says if you want to be sure that no one gets this, that if you've been exposed, that you don't spread this to someone else, 14 days is kind of the gold standard for how long you need to quarantine yourself. However, and these are all spelled out here, we took this right from the CDC website. If I've been exposed and after 10 days, I have no symptoms, I've been monitoring myself daily, and I return back to my workplace, my school setting, there's about a 1% chance with the upper limit of 10% that I could still be infected with this virus. If I get exposed to COVID-19 and after 7 days I have no symptoms, I have been tested at least 48 hours before that 7 days, that test is negative, I can then return back to my work or school setting, and then there's about a 5 to a 12% chance I could still have some infectivity and I could still infect someone. But those, again, the shorter the time period, there is some chance of infection, but it's extremely, extremely low. If you've known anyone who's had COVID, you know that by about day 5, that's when people are really ill. So this is no symptoms at all. It's very important that you read through that. And the local health departments are following these guidelines as well. So gold standard is 14 days, 10 days with no symptoms at all, or 7 days with a negative test and no symptoms at all.
Thank you, Dr. White. Okay, Tony, next slide, and I think we'll be turning it over to Dr. White.
Okay. All right, well, I just wanted to give you a really 5-minute update because some of you watch the governor's press conferences, some of you don't. I just wanted to show you the good news, but the cautionary news. This shows our positivity rate, and you can see since January the 10th, that has gone down significantly. There's been a continual rise since I still go back to Derby Day when we had started seeing things go uphill, but we're right now at 7.78. I know I've had several people when we were doing our round robin of the school board say, well, you're seeing more or you're seeing less because you're doing more testing or doing less testing. Next slide shows you that if you look at the blue line, that is the positivity rate, the number of positive tests, and the orange line is the number of actual tests. So you can see from January 6th through February 6th, we've done about the same amount of testing, but look at the difference in that positivity rate, how that has significantly gone down over the last month. Next slide. I wanted to touch on this. We've talked about equity and the importance of that. This is where we are as of yesterday. This is looking at race. The blue line is the population. The red line is the number of cases, and the green line is deaths. Now, if I had showed this to you in June, you would have seen that the African American case rate was up in the 16%. The death rate was in the 10% or 12% range. And over time, with a lot of work by a lot of very dedicated people, we're seeing that the rates of cases and deaths of the cases and deaths that we do have a race and ethnicity reported, we're seeing those are beginning to better reflect the population. In the Hispanic population, we're seeing still a higher rate of cases. We think that has something to do with the jobs that these folks hold, the transportation they have to and from their work with a lot of carpooling, a lot of multi-generational families living together. That has gotten even lower. The 5.6% is a bit lower than what it has been, but I wanted to share that with you so you could all see some of the progress Kentucky has made. The next slide, we won't go into any great detail, but y'all have seen this purple slide before. Every bar is a week from March the 16th. We have not had that many weeks where the numbers have gone down in the entire pandemic. And if you look at that 1 week of December the 21st to the 27th, that's the week of Christmas where we only had about 3 days of testing. So we diagnose fewer cases, that would fit. Then we had our after Christmas peak, and now we're seeing that go down. Next slide. This is a slide that y'all have seen 1,000 times, but I never thought I would be so excited to see orange. We're seeing more orange. We're seeing some yellow. This means that our 7-day average rate is improving statewide. Next slide. I'm particularly proud of this one. I know this doesn't sound like a lot when you're talking to a group of educators who are dealing with younger kids, but if you look at this shows the capacity of the hospitals in the state. And if you look at Region 10, our cutoff is if you have an 80% ICU bed rate, inpatient bed rate, or ventilator rate. So Region 10 has got an 80% rate. They've been in the 95 and 97s in the past. And Region 7 has an 81% rate. So we're very close to all of our regions having the hospital capacity in a state where we can take some deep breaths and feel like that people can go to the hospital with things other than COVID, and there's bed capacity, there's staff capacity to take care of your illnesses. Next slide. You've seen this one before. This shows the rate of cases of Kentucky versus the rest of the country, and you can see that Indiana and Tennessee certainly have a higher case rate compared to population across the country. But the one that I've put up that you haven't seen is the next slide, and I particularly think that we as Kentuckians should be proud of this. This is the death rate. Look where Kentucky sits and look at our surrounding states. For a state with as much chronic chronic diseases. We have, there have been a lot of people on the ground working extremely hard in the healthcare community, public health community, leaders of communities who have helped to keep that death rate so much lower than the rest of, especially the states around us and even the rest of the country. Next slide. I wanted to show you where we are with vaccination. The orange line shows the unique vaccinated persons. That means the first vaccine. And the blue bars is the number of vaccine that we are allocated by the federal government. And I think it shows, again, a lot of hard work on a lot of people's parts to get those vaccines administered to people as quickly as we can. The number of vaccines is obviously not enough, but as soon as we get it, we are giving it to people. So there are a lot of efforts. We are very pleased, and as a Kentuckian, I'm very proud that the state of Kentucky thought the mission of the K through 12 population was important enough to do what we were able to do over the last 3 weeks. There's a few stragglers that haven't gotten their vaccine that they signed up for yet, but that vaccination program we finished it up the week we had projected we would start it. So we were very pleased with that. The last slide I wanted to bring up, I kind of put this together today after talking with our, we meet every Thursday, the KDE and KPHA, KDE and KDPH people. I'm sorry, it's been a long day. It's celebratory season. Most people think a celebration is Thanksgiving and Christmas. We've got a lot of things going on coming up. These are events that many of us don't think much about, but in the school setting, you're going to have people are going to start asking questions. I've already had questions about Valentine's Day. Have kids bring their Valentines the day before and then pass them out the next day. We're not seeing lots of transmission from paper type products. I'd be more worried about doorknobs, those kinds of things where there's snotty hands and touching surfaces. But if you bring those Valentines in the day before, put them in a box, you can pass them out that next day. Same thing with St. Patrick's Day cards. I've had questions about flowers delivered on Thanksgiving. It never crossed my mind. I don't usually get those myself, but I would say if someone delivers that to the front desk, you're not going to have delivery people coming throughout your school system. They deliver it at the front desk and people pick it up on their way home. So think about the events that you weren't able to have last year and how are you going to make some allowances to make these safe events. So remember, as we've said before, hands, face, and space. If you'll think of those things as you're looking at Passover, Easter, Derby, whatever events you might be celebrating with your students and your staff, just remember those as you're moving forward. So I'll be around at the end for any questions if somebody has any. Thanks, Tony.
Okay, thanks, Dr. White. Thanks, Kelly. And I know that you'll be on for a little bit also to answer questions. I know that we'll have several around the items that you raised. We're going to shift now to the CRISA funds, the new ESSER 2 funds that are coming to districts, the part of that KDE has control over, and also talk a little bit about the GEAR funds from the governor's office. So we'll turn things over to Robin Kinney and her team now to talk about guidance that has just come out around that.
Thank you very much, Commissioner. It's a pleasure to be with you all again today. Before we start into the slides, I just want to call your attention that we do have written guidance on the use of ESSER 2 funds. It's entitled COVID-19 Guidance for Schools. It's dated February 8th, 2021. It was released yesterday. So I'll call your attention to that. It was also posted in the Commissioner's Monday message of yesterday, if you're looking for that quickly, but it is out off of the KDE COVID-19 website. I want to thank the cross-agency team across the Department of Education who worked very hard to put together the guidance for ESSER 2 funds and update this guidance for you. It's pretty comprehensive, but I will say, as always, even though we try to think of everything, there will be some questions that haven't been answered. And as recently as right before this webcast, there were several of us on a national conference trying to learn as much as we can to convey to you about permissible uses of the funds and to provide additional guidance. I'll also say, because we use that cross-agency team, you'll see the contents contained in this guidance document. At the very end of the guidance document, there are contact names for each of the specific areas. So, for example, if you wanted to ask further on the guidance about 21st century, there's a contact name there, or a special ed question, there's a contact name there. We're providing that to you in hopes that if you have those specific questions, we can get you to the right staff. This is a kind of a continuation of our discussion that we started back in January on the Coronavirus Response and Relief Supplemental Appropriations Act. That's that new CRISA Act, as opposed to CARES, which was under ESSER 1 and ESSER 2. There is ESSER 2 funds for public K-12 schools, and GEAR 2 funds, which have been appropriated to the governor's office, and that includes amounts for public schools, either K-12, higher education, or educational partners, and a set aside for services to non-public K-12 schools. We are going to talk about that non-public K-12 school allocation in a separate webcast. We think that we probably need to have a specific webcast just for those eligible entities. So we're not going to spend a lot of time on that today, but I just wanted, for our listeners out there that are listening from our non-public schools, we will have separate information provided to you on those funds. As a reminder, out of the ESSER 2 funds, there is a 10% maximum state set aside and amounts allocated for administrative costs. And permissible expenses can go back, just like in ESSER 1 and GEAR 1, to March 13th of 2020, which is the date of the declaration of the emergency related to the pandemic. And these funds are available a little bit longer based upon when we are receiving them. They are available for obligation through September 30th, 2023. Remember, the ESSER 1 funds were through 2022. These are through September of 2023. I guess as we continue our discussion on ESSER 2, I wanted to provide sort of some overarching principles or things that you need to think about overall as we talk about the expenditure of these funds. First and foremost, I guess I would share with you that the purpose of the ESSER program is to prevent, prepare for, and respond to the coronavirus pandemic. So I think that's a really important question if you'll keep in front of you as you are making decisions about how you would like to expend these funds. So for every expenditure, you should circle back and say, how does this prevent, prepare for, and respond to the coronavirus pandemic? We know we have lots of other needs for our districts, our students, and our staff, but really these funds need to be targeted toward that purpose of the program. And we also need to be asking ourselves, as we do with lots of expenditures from federal dollars, is the expenditure reasonable and necessary? So I would encourage you to keep those two things in front of you. Also, another overarching principle, it is a significant sum of money that we're talking about here, but it will go away. Federal funds this is not for recurring expenses. We think about total cost of ownership, that is a phrase that's sometimes used, or if you are expending on something that's going to create a continued maintenance or ongoing expenses as a result of your initial investment. As we talk about the allocation itself, and I see we've advanced to the next slide, the allocation is for ESSER 2, $928 million. The same CARES Act permissible uses are permissible for ESSER 2 dollars. And I'll refer you specifically to pages 4 and 5 of our guidance that we've put out for ESSER 2. And on those pages, you'll see the specific listing from the Act that talks about the specific permissible uses. There are no equitable services requirements for LEAs. So under ESSER 2, you are not required to provide those equitable services. We will handle that at the state level through the Emergency Assistance to Non-Public Schools funding. We will require, just like we did the last time, new assurances to be signed, and a spending plan by May 15th, 2021. So very similar to the ease of access to ESSER 1, we'll just ask you to sign that new assurances, and you'll be doing that in GMAP. Similar CARES Act reporting requirements. We will, as a state agency, will be providing a detailed accounting within 6 months. And because even though they are a supplemental amount of funding, we are asked by the federal government to track these funds separately from ESSER 1. And you'll see the Munis project number there at the bottom. There are broad permissible uses, as we've talked about before, going back to what you can use them for. Again, I would encourage you to go to page 4 and 5 of the guidance that's been provided so you can see that very clearly. Now, I also usually put on a slide, they are not subject to supplement, not supplant provisions, and that is accurate. But I always, whenever I say that, want to follow that up with some guidance given by our folks in the Office of Special Education and Early Learning, because they have special reminders for the use of ESSER 2 funds and the IDEA. So I'm going to turn it over to Chris Thacker from the Office of Special Education and Early Learning for the next slide and some additional guidance on that. Chris?
Thank you, Robin. I appreciate the information that you've shared. The good news, obviously, is the additional funds that local districts across the state are going to have available to them to offset the cost of this pandemic. However, under the Individuals with Disabilities Education Act, there are those maintenance of effort requirements that are still in place. They exist both in statute and in regulation, which makes them very difficult, if not impossible, to administratively waive those requirements. It is impossible at the KDE level, very, very difficult at the federal level where those funds are generated. Robin mentioned the supplant issue, and that is where this comes into play. The IDA requirement is that you cannot supplant state and or local funds used to provide special education and related services. You can supplement those costs, but you don't want to replace them with these ESSER funds or any other funds for that matter. So if you are a local district finance officer or local district director of special education, you're probably familiar with that annual document that comes out of our office for capturing data around the IDA's maintenance of effort requirements. That document will continue to be out there. Probably the next version will come in the next month or so to be looking at. But it's going to be collecting owed information. It'll be next year probably before we start capturing information on how these ESSER funds are impacting the circumstances. So you need to be prepared now as you are receiving these funds and spending them, how best to do so that you don't get yourself in a maintenance of effort issue or concern. MOE has both a compliance requirement and a eligibility requirement. The compliance requirement looks at what you actually spent. So are you spending out of your general fund, which are your state and local dollars, in generally speaking, that provide special education to your students with disabilities? Or are you continuing to spend that same amount? The other requirement is a budgeting requirement, and that's called eligibility. Are you budgeting enough state and local funds to meet that same requirement? So these maintenance of effort requirements will remain in place. If you budget appropriately from state and local funds, then you'll continue to be eligible for IDEA funds. If you spend the appropriate amount of state and local dollars from your general fund to provide special education related services, you'll remain in compliance. However, if you don't meet the compliance criteria, there is a requirement that funds be returned to the U.S. Department of Education equal to the amount that you failed to spend. And of course, that has to be paid from non-federal funds. So that's something to keep in mind. I would suggest that as you go through spending, when you look at the Munis template code that's being used, the 200 program series are the special education costs. Spend out of your general fund for those 200 program level costs the amount necessary to maintain your effort. And for you finance officers who are familiar with that document that we use to measure your maintenance of effort, you probably know right what we're talking about. So in essence, while it's great to have these extra monies, please continue to use state and local dollars to provide special education and related services to children with disabilities, so you don't get in a place where you are out of compliance and have to replace funds to the federal government. Robin, I'll turn it back to you.
Thank you, Chris, for that information. You know, we do have some time, and another thing that is sort of the overarching principle as we start planning for expenditure of funds is to take your time. Be strategic. Think about the long-term consequences of some of your decisions. So appreciate Chris coming on and talking about ESSER funds and the IDEA. Next slide, please. So let's turn now and talk for a minute about the Governor's Emergency Education Relief 2, which is the GEAR Fund. Kentucky's public schools GEAR 2 allocation is $19.5 million. And we've talked a little bit about that emergency assistance to non-public schools, the Kentucky allocation of $40.8 million. KDE is responsible for the administration and oversight of EANS. And so LEAs do not need to provide those equitable services as part of GEAR 2 funding, depending on if that allocation comes to public schools. We will be providing that further information on EANS in a separate webcast, so we're not going to spend a lot of time on that here today. We look forward to really talking with the non-public schools about the application process and how funds or services will be distributed accordingly. Next slide, please. I thought I would spend a few minutes talking about operational updates. These are things that we've kind of learned or we've developed more fully since our first broadcast on this topic back in January. One of the things that we wanted to clarify is even though understandably there is a shorter period of time for expenditure of those ESSER 1 funds, we know that a lot of districts have gone ahead and budgeted and have planned on how to expend those. I think when we had announced it in January, it was a requirement that we had shared that you had to expend all your ESSER 1 funds before your ESSER 2 funds. But we now have an update and clarification on that. You do not have to expend all your ESSER 1 funds, but you do need to be cognizant of that shorter timeline for expenditures. So they are recommended to be used before ESSER 2 funds, but not required. We know that a lot of you have already budgeted those and have plans for those expenditures, but it doesn't preclude you accessing your ESSER 2 funds. We've also had some questions on the payment of staff, and if you are going to utilize ESSER 2 funds, you would follow those federal requirements for the payment of staff, federal withholding. If you are looking back in time and reimbursing expenditures for staffing, you do not necessarily have to do that. For facilities, that is a topic that has been highlighted, I guess, in the ESSER 2 guidance and information provided by the federal government. And expenditures on facilities are permissible. It's one of those that's carved out, as I referenced on page 4 and 5 of the guidance. So if I can again refer you back to 4 and 5 of our new guidance that just came out yesterday, so you can see the specific language that talks about permissible uses under the Act. And then I would also make sure you're continuing to ask yourself that overarching question that we talked about at the beginning of the presentation, is if these expenditures are going to prevent, prepare for, and respond to the coronavirus pandemic. Within the guidance document, also on page 13, you'll see some additional information on an expedited process for facilities. So this is permissible. It's not as familiar as a permissible eligible expense under some of our other federal funds that come to us. So we'll continue to update you on what facility expenditures look like. We've also had the opportunity to have lots of questions that are coming in from districts, from individuals, and also from our educational cooperatives, and appreciate very much them sending questions to us. We will be posting that FAQ very soon. As we were looking at it and trying to get it done for today's, we had a little bit of cleanup work that we still need to do, so we'll do that. Our goal is to get that posted by the end of this week. And we want to continue to take your questions. So if you have a question that you'd like to submit, if you can email that to the COVID-19@education.ky.gov mailbox, and then we will add that to our running list of FAQs. Next slide, please. I also wanted to share with you some conversations that have been happening here at the department. Earlier in the presentation, we talked about a state set aside, and the state set aside for ESSER 2 is $92.8 million. That set aside already happened before allocations were made to local school districts. So as part of the use of that state set aside, we here at the department look at needs related to the pandemic for our Kentucky School for the Deaf, Kentucky School for the Blind, our area technology centers, and projects that would really support statewide efforts for our local school districts. So we are currently in the process of doing that. The leadership team here has met and we've discussed projects that might fit into those categories, and we're trying to nail down determinations on that. However, we always like to try to think about how we can continue to support our local school districts. And we do believe there will be a district opportunity to access a significant portion of the state set aside. Next slide, please. So we are providing this high-level information to you because we know that you are starting your planning and your strategic development of how you would like to use your funds that have already been allocated to you. So really this announcement really is to help you just kind of keep it in the back of your mind as you're planning the expenditure of your own dollars. Our goal from the state set aside is to provide an additional minimum of $75 per student. So it would be based and allocated on a per pupil allocation. And there's a couple of things in order to access this additional pot of funds that would be required. And I've put those on the slide. The first would be, we would be asking districts to spend 85% of your district allocated ESSER 2 funds on direct services to support students. And by April 1st, 2021, and on an ongoing basis, offer 12 or more hours each week of in-person instruction to students who request it. So these would be the two primary requirements to access this other additional pot of funds that is currently in the state set aside at the Department of Education. Next slide, please. So obviously the very first question, and we'll be fleshing these out after we make determinations on funding for those KSB, KSD, ATCs, and those statewide projects. But of course, the very first question that people usually pop into their mind is, what are direct services? And we'll be working to flesh those out. Probably the easiest way for us to do that is define direct services through the alignment with either Munis code saying these would be permissible to be counted towards your 85%, or these would be excluded from your 85%. But think of those in terms of direct services that benefit your students. We would be asking for a separate assurance and spending plan, because obviously if we're asking that you spend 85%, or you are agreeing or assuring to us that you will spend 85% of your ESSER 2 funds on direct services to students, we would ask you to assure that at the beginning under a separate assurance document. And then we'd ask for a spending plan. We would ask for action by your local board to evidence the 85% assurance, and we'd also be asking that in terms of the instruction, in-person instruction for your students. Permissible expenditure from this state set-aside pot of money would be the same as under the original district ESSER 2 allocation. So once those funds are allocated to your district, you would be able to expend those dollars using the same permissible purposes as ESSER 2 allocations to your district. And then we would have similar reporting requirements on the use of these funds. Next slide, please. And that's all we had on ESSER 2. We look forward to continuing to hear from districts on their ideas for expenditure of funds. And I'm going to turn it back over. I think it goes back to Tony or the commissioner for questions at this point.
Well, it goes to me. Thanks, Robin, for that overview. I know it's a lot of complex information. The one part that we want to make sure we touch on is thinking ahead to the February 23rd special superintendent webcast. You've heard a lot of information from Robin about the ESSER funds, the GEAR funds, and the state set-aside funds and the conditions around that. What we'd like our districts to do over these next couple of weeks is start formulating preliminary plans on how you'll use those funds. So that ESSER 2 funds that are coming to you in the title distribution, what are your plans for using that? If you want to access that additional pot of funds that Robin talked about with the state set aside, and that means you need to use 85% of your ESSER funds on direct services to students. So things that are creating experiences, things that are learning opportunities for students, things that our students are getting or receiving directly. You need to use 85% of your resources on that. And you need to think about, and I know most districts already are offering at least that 12 hours of in-person instruction for students that requested after April 1st. I want to note on that 12-hour requirement, there may be exceptions to that are granted due to quarantining or other disruptions that come, but we need to have a design in place. So we're asking our districts to think about how they might put together a plan for your community. We're going to ask some of our district leaders to come on with us on the 23rd and talk about their plans and what are their thoughts around how they would use their ESSER funds, the GEAR funds, and the state set-aside funds in their community, just as a way to get a cross-pollination of ideas going about how these funds could be spent. We hope that we see some creative ideas, some ideas that are really focused on improving student experiences and making up for so much of the things that our kids have missed out on over this past year going forward. There was a great article in Education Week that came out this week that was an interview of students and what their thoughts were about the concept of quote-unquote learning loss and what they had missed out on and what they had experienced over these past few months. And I think it gives us some insight into how we might approach this in our community. Superintendent might reach out to your teachers and your students and your parents and have a conversation with them about what are the things that they missed out on, what are the things that they need going forward now, and then build your plan for where you'll use these ESSER funds, the state set aside, and any GEAR dollars toward meeting what your community and your students and your staff have told you that they really need. I think that'd be a great way to go about this. I just wanted to put on your radar that February 23rd, be thinking about that, and we'll be reaching out to some of you to come on and talk about that with us. I know that I'd hoped to get some questions in before Kelly Foster had to leave us, just any of those detailed questions around coming back after vaccination. We still have Dr. White on us to answer any medical questions, and we'll do our best to answer any questions that come up related to that with Kelly not here. But we'll also, if there's something that we're not able to answer right now, we'll make sure that we get an answer and send that out a little later. Just one final note before we turn things over to Tony to walk us through some questions. We did send out the PowerPoint for this event in advance. Over the course of this morning, we had some changes that came into that, some additions to slides, some alterations to slides, just as we started to get feedback on it. So we have an updated version of that you saw today. We'll be sending you the updated version as a follow-up to this meeting as well. Thanks again, everybody, for being with us. We appreciate your attention. I know it was a lot of information, so we're going to spend some time answering questions as best we can. So Tony, let's turn it over to you and see what we've got on the Google Sheet.
Perfect. Thank you, Commissioner. So our first question for Dr. White, going back to some vaccinations. There's a question here about the second dose of the vaccine is going to be administered to staff who've opted to have the vaccine at the end of this month, and they're desiring to return to daily in-person instruction after the 14 days have passed following the booster shot. However, they're not sure if that will be possible under the governor's executive order that remains in effect. It requires them to follow the Healthy at School document. They're concerned that they cannot achieve the 6-foot social distancing if they're not on the hybrid model. And so the document, there's just some questions around that wording, and they're saying that they remember Dr. White mentioning that it was not meant to provide a loophole. I don't know if you can see the question in the Google document. If not, I can go on, but maybe you can address some of those.
I think that's something I read earlier this morning. Is that correct?
Yes, ma'am.
Yes. As far as going back to work with the vaccine, you can go back into your school setting without waiting those 7 days. Lots of people have been teaching and working in the school setting, and that's not addressed in the Healthy at Work, a Healthy at School document. What I said before was the Healthy at School document, when we first put that together back in June of last year, that seems like a decade ago, but that was just last year, not even a year ago. There was concern that they could maybe not get the kids 6 feet apart, but they could do 5.5 feet. And was that good enough? And so we did give a little bit of wiggle room in the document, but that was not a pass for people to say, oh, well, we can't do 6 feet. That means we're going to cram everybody 2 feet apart. That's not the intent. We are trying to keep a deadly respiratory virus from spreading from student to student and student to staff. So by keeping that 6 feet distance, that is your best mitigation to keep a transmission of this virus. And the closer you put people together, the higher that risk of transmission is. So as you're looking at your school system, and we've talked numerous times about using cafeteria space, using gymnasium space, using bigger rooms, it's not an easy answer, and I don't have an answer for you because each one of you has to make that designation on your own. But if you put a bunch of kids close together in a classroom, the risk of transmission is greatly higher, and I would not advise that.
And I just wanted to reiterate what Dr. White's talking about and pointed out to superintendents where they can go in the Healthy at Schools document. Page 7 under safety expectations is where it's talking about the spacing, the 6 feet. That seems to be a big question in the Google Doc. So if you look on page 7 of that Healthy at Schools, it talks about the 6 feet or greater. And then it also has the bullet that says that if the physical space in the school does not allow for spacing desks 6 feet apart, do as far as possible. So, there is a little bit, as Dr. White mentioned, wiggle room there, but you're really going to have to look at trying to take advantages of all spaces in your building as you start to bring more and more students back. But once again, that's at the bottom of page 7 of Healthy at Schools.
Great. Thank you to both of you. Another follow-up question with this guidance is on mode of instruction. They say they understand that the executive order, it remains a recommendation. They just wanted to clarify that this remains a recommendation before they make a final decision.
To my knowledge, and Commissioner Glass has a closer contact with the governor's office than I do, that the Healthy at Schools document isn't up for any upgrade to my knowledge.
Yeah, we're not expecting any major changes to the Healthy at Schools document going forward. I think it's safe to assume that that's going to be the standard and the expectation by which schools should operate for the foreseeable future through the end of this school year. There are some conversations happening around the color-coded document, what may happen with that just as we enter this new phase where we have large-scale vaccinations taking place, but none of that's been determined yet. It is safe to continue assuming that the Healthy at Schools document, the expectations that are within that should continue forward.
Okay, and then one question, another follow-up, one last question from that particular superintendent. They said that they read in a recent article that Governor Beshear is going to relax the mode of instruction recommendations based on local data. Is there any indication of when that guidance or information will be forthcoming?
And that's really what I was just referring to, the color-coded document and the matrix that comes with that. There are conversations happening around some changes to that. I'm not at liberty to disclose those right now, and I don't know when exactly that would happen, but I can confirm that those conversations are taking place and are being considered.
Okay, great. All right, moving on to the next question. We have quarantined over 1,400 staff members in our school district to date. Out of the staff we have quarantined, we have no staff members that have tested positive as a result of the contact of the quarantine, since the staff members were wearing their masks. Since the CDC research is recognizing similar results, just wondering if there is an opportunity to revise the quarantine requirements again, or if this is going to stay in place.
The quarantine that Dr. Foster and I just reviewed earlier is the most recent quarantine recommendations that I'm aware of. That doesn't mean that with a new CDC director, I know one of the first things she did was to ask Dr. Ann Shuckett to look at everything related to schools, look at all the more current research, look at what the CDC has recommended. Dr. Shuckett, I've known her for years. She is a world-class researcher, and if someone gives her a project, she will do it piece by piece as thoroughly as any human can do. So will the CDC come out with some changes once Dr. Shuckett has her review? That's always a possibility, but what we have in our documents now is the latest recommendations that have come out of the CDC.
Perfect. The next question is, please clarify if you've had both doses of the vaccine and are exposed, do you still need to quarantine?
Yes. Just because you have been vaccinated, that means you have a 96% chance you will not get severe illness, will not be hospitalized, or die from this illness. But that does not mean that you cannot be infected with COVID-19, which means you could be an asymptomatic spreader. That's the data we have today. We're hopeful that will change, but right now that is the information we have today.
Perfect. Looking to see another question. I've got a couple of Esther. I'm trying to keep all of the vaccine ones at the top here while we still have Kelly. Okay, to clarify, after the prioritization of school staff in the Commonwealth for vaccinations, the only change is the elimination of the executive order, correct?
I'm not sure about the executive order, but they are correct in the fact that just because we have vaccinated the staff of K through 12, that doesn't change any of our face, hands, and space recommendations. Those still stand so that people who are vaccinated not inadvertently get infected and spread to others.
Okay.
It's really what I was talking about earlier when it comes to managing the expectations in our communities and with our staff and with our students about where we are right now. Because our staff is vaccinated doesn't mean all of this now goes away. We still have some work to do to get out of this. What the vaccine means is that your staff is much less likely to get severely ill if they contract the virus. That doesn't mean that the virus is still not moving in our communities and doesn't place risk on people, especially those who have not been vaccinated yet. So we've got work to do to continue the virus mitigation strategies that we have in place for the foreseeable future until we can get the prevalence of this virus really down to a low level where the risk is fully mitigated.
Thank you.
Okay. The next question is, if we are testing close contacts with no symptoms to be released from quarantine after day 7, should we just consider a negative PCR test, or can we consider a negative rapid test?
I would certainly recommend the PCR test. The rapid test have the data that they present with the rapid test is for symptomatic people. And so the data on asymptomatic people is not nearly as strong. So if I were looking to go, this is me personally, if I were looking to go back into a work setting, whether it's a school, whether it's a factory, whether it's where I'm sitting right now, if I'm going back into a setting and I want to be sure that I'm protecting those around me, I would want a negative PCR test.
Okay. This one is going to go towards accommodation rights for employees. So I'm going to jump down to that one. This is in terms of the first COVID vaccine. What are accommodation rights for employees who wanted and signed up for the first COVID vaccine? However, they were unable to get that initial injection due to having symptoms or being COVID positive on the day of injection. What accommodations do they have a right to and for how long?
I know that we've got Ashley on to help answer legal questions. So Ashley, you may want to come on and answer this, but I don't know that the executive order contemplated this exact situation, nor has our guidance contemplated this exact situation. From an employer standpoint, if I were a superintendent looking at this, I had an employee that wanted to get the vaccine and couldn't, I would continue the accommodation for them. But that's a values decision that I would make. We've got a legal and a health expert on here who may be able to weigh in as well.
And Ashley, before you answer that, just be clear that if you are a K through 12 staff, you are still in the 1B. So you can still get your name on the list and you could still get in line to get a vaccination now. It won't be like the last 3 weeks where it was all, all laid out for you and you just knew you were going to get it done. But please get your name on a list as quickly as possible because you will be vaccinated with the 1B group. So it's not like you're going to have to wait till this summer to get vaccinated. But you won't get vaccinated if you don't get on the list because nobody's going to know that you need that vaccine. Sorry, Ashley.
No, that's great. Thank you. Sure. I would certainly agree with Dr. Glass and Dr. White here. I think if you fall within 1B and you haven't had an opportunity to get vaccinated yet, you would still fall within numerical paragraph 6 of the executive order, which would give you that protection until 7 days after your second dose.
Great. Thank you all. Dr. White, just a clarification here. Our local health department and CDC guidelines state that they do not need to quarantine anyone who has had COVID during the last 90 days. However, there's been indication that they should still quarantine them during the last webinar. And I think I don't know if you've addressed this directly, but can you please provide them with some clarification on this particular question?
Well, I think the 90 days comes from the fact that when they're looking at people who've been infected, they do have antibody production as you would after any infection. And on average, people will have antibody protection for 90 days after an infection happens. We know that if you get a vaccination, the amount of immunity goes much higher and lasts much longer than those 90 days. So I think the decision as to whether or not to quarantine someone depends on, do we actually know what your antibody levels are? Do we know for sure that you are someone who can't get reinfected? We have seen reinfections, pretty severe reinfections in a rare number of people in that 90-day period window. So I would say, I would need to give you the exact guidance from the Department for Public Health because I know we just developed a guidance on that and I don't have it right in my head. But certainly if somebody is 95 days away and they get exposed to someone, I would certainly look at quarantining those folks because they're at the very end of that 90 days. I will find that reinfection guidance document and get that to Tony to be sure that we send that out so that the information you have is the same information that we're giving our local health departments because I know we've changed that recently. I don't want to muddy the waters with an incorrect answer.
Okay.
I just while we appreciate you being with us. Just a technical note: if you could move your mic up around the cable and up closer, so people can hear you clearly.
Sorry. Thank you.
That's great. Thank you.
Great. The next question is, and I'm not entirely sure if we know this, but I'll go ahead and ask it just so you know, we try to get to all of our questions. How many school districts plan to be back in session before the end of this current school year, adhering to the 6-foot social distancing guidelines? Do you know, and could we be provided a list?
Is that a question to me?
No, I think that's more for KDE staff, and I'm not entirely sure if we are keeping, I'm not sure if Kelly is still on or Robin is still on. I'm not entirely sure. I know that, KDE's the Robin or Kelly, are you on?
I'm on. This is Robin.
In terms of, we're not really keeping track of which schools are back in session and offering, in-person services or beyond that. I mean, I'm thinking that we could possibly try to answer that question, but I mean, in terms of an official list, we don't have those, correct?
No, we don't have an official list that would say that. Of course, things change so rapidly. I will share that we had gotten some information from the Kentucky School Board Association, who has been trying to keep up with that a little more meticulously. I don't know that they have just-in-time information either, but they may be a good resource. I've just added them as a possible resource that might be helpful. So, but we did check into that just with them a couple of weeks ago.
Perfect. Thank you, Robin.
You're welcome.
All right, the next, it looks like those are pretty much that we have right now related to health. I'm going to move on to the ESSER and the GEAR questioning. I think, Dr. White, there might be some other ones that may come in here afterwards. Okay. So moving to the top of those questions, can ESSER 2 funds be used to help fund the construction of a new school? For example, our older schools do not have adequate spacing, technology, and ventilation systems.
So construction of a new school, as we talked about earlier in the broadcast, you can use it for construction expenses. I guess I would encourage you to think about a couple of things as you're considering that. First, I would make sure that you're considering that question, that overarching question, how you're tying that to the prevention or control or making it linked to the coronavirus specifically. So that would be one thing that I think you would have to do. I would also encourage you to think about the time that you have to expend these dollars. So that's another thing. And then I would also encourage you to think about, as the commissioner is kicking off his talking tour and talking about aspirational, what schools are going to look like in the future, I would encourage you to think about that in terms of facilities and your need of facilities. We've already had some discussions from some of our local districts, asking about remote learning and opportunities for remote learning to continue. So I think those are all things that you need to consider as you're thinking about the expenditure funds from ESSER 2 for construction purposes.
And just
Commissioner, do you have anything to add?
I would, yes. So the other consideration, I think, in addition to everything that you've said, Robin, is if a district used its ESSER funds for construction purposes and you exceeded that 85% amount that we talked about for the state holdback, you will not be receiving that $75 per student additional. So you only, of your ESSER funds, you can only expend 15% of that for things like construction projects if you want access to the part that KDE is allowed to hold back at about $75 per student. So we really recognize that there are additional costs for schools that are serving students in person, and we want to create that incentive for these ESSER funds to be spent on experiences, learning opportunities, and things that students have missed out on. So if you spend your ESSER funds all on construction, you will not be getting the holdback 10%, that $75 per student additional that we have available.
Okay. Thank you both. The next question is, during the first round of ESSER funding, private schools were allocated a portion based on a Title I formula. Do we know why this is not happening again? Many private schools have been open for in-person school for the majority of the school year. They've suffered enrollment loss and incurred increased expenses for PPE. If the private schools are going to receive a portion of GEAR funding, and by whom will they be notified?
So I'll take that. I'll try to answer, and Commissioner, if you have anything to add. But, when we talk about the allocation from the federal government for both ESSER 1 and ESSER 2, we go by what is contained in the Act. And so under ESSER 1, there were certain provisions allotted for private schools, non-public schools. And I think the way they addressed it in ESSER 2 is through this GEAR set aside of $40 million that has specifically been set aside for those non-public schools. As far as notification, I would encourage you as a non-public school to continue to monitor the KDE website. We will be making those announcements to you. And we'll also try to work through our local districts that can share those communications. We'll make them aware of when we will also be having those future webcasts, so they'll be aware of that. Even though they don't have a role in that, we know that many of them interact and talk with the non-public schools, so they can share that information as well. But you should see KDE as your primary source of information as far as getting information on the EANS and how that will be distributed. So we'll work with Tony in our communications office and make sure that non-public schools are aware of that.
Great. Thank you, Robin. Dr. White said she had some additional information that she wanted to provide. Dr. White?
Yes, the question about quarantine and after you've had an infection. I checked with our state epidemiologist, and he said that after you have had a COVID infection, you do not need to quarantine if exposed after those first 90 days.
Perfect. Thank you very much for getting such a quick response for us on that one. The next question that we have is going back to ESSER. Let's see here. I am not seeing in the guidance if we can use the funds for previous personnel costs and whether or not federal matching is required.
So we had a little bit of information in the presentation today, but we're getting a lot of questions about salaries and payroll and reimbursing and looking forward in federal match. So we will be having a finance officer webcast to really, because we know our finance officers always have additional really good questions about coding and how to really the mechanics of how to work through the ESSER logistics. So we're gonna wait, and we'll actually address that in a finance officer webcast. We'll have that scheduled likely next week. It'll be before we can get to that, but next week look for that invitation coming to all of our finance officers.
Okay, great. And then just another question on when the ESSER 2 assurances and spending plan will be available in GMAP. We are ready to utilize these funds now.
So we have the assurance already prepared. We have to load that into GMAP. So the first date that we'll have that available, we're shooting for a date of February 19th. And that'll be the first date that you can actually access that assurance document. If we have any changes or run into any problems of that, we will certainly provide that additional information in the Commissioner's Monday message. So be looking in the Commissioner's Monday message for evidence that, that is good to go on February 19th.
Okay. Moving on, a couple of questions about using ESSER 2 funds for salaries and additional allowable use for finance officers, and I think Robin has addressed those. They are going to have another webcast just for finance officers, so I'm going to go ahead and mark those as asked. Let's see here. Well, another question. Will SEEK be reduced to offset these funds?
So I know back in December, appreciation to all your finance officers and local school districts as we worked on SEEK for December and how that interacted with the Coronavirus Relief Fund. These are separate funds than that. And at this point in time, we don't have any indication at all that SEEK will be affected by the use of ESSER 2 funds.
Okay. Let's see, some more questions. Let's see here. When will the ESSER funds? I think you asked, did we address when the Gear 2 allocations will be announced?
We don't have a date for the announcement of the Gear 2 funds yet. We continue to work with the governor's office on what that will look like. And as soon as we have additional information, of course, we'll let local school districts know about that.
Okay. And there's a question about the recoding on the paychecks originally paid from state and local funds. This is the additional information you're talking about that we will get to them at a later date, correct?
Yeah, I would encourage all the finance officers to tune into the next finance officer webcast.
Perfect. All right, there's a couple of questions in here related to out-of-state travel. So I just want to get up to there because I'm getting asked the question again. So I just want to get in there so people don't think I've forgotten that. We have building level administrators reviewing future travel requests out of state. What is KDE's stance on out of state travel at this time? Very clearly, this is not travel to a bordering state. There's a current request for a national dance competition in Florida. We are hearing that other districts may be approving such opportunities.
Well, I don't know that we have a position on this. Presently, it's really a local determination as to when out-of-state travel would be allowed. I don't know if Kelly's still on and is able to answer that, but I don't know that from KDE's stance that I, as the commissioner or the state board, have the authority to direct how you handle out-of-state travel.
Okay. And then there's in that same for the DPH question is what is DPH's stance on out-of-state travel for students during the current school year and summer of 2021, and what factors should they consider to allow future travel?
Well, I would support Commissioner Glass because he's the authority on these things. But I will say that the governor is recommending for people not to do out-of-state travel, and if they do, that there's a quarantine period when they come back into the state. And there is the governor's health and guidelines about travel that you can find on the kycovid19.ky.gov website, and I would go to that for the current guidance.
I think here, this is a really difficult question because I know that school districts are getting requests from teams and groups to start traveling in the summer and even beyond, and you have to start making plans, and it's really tough to continue to tell people, no, you can't go. I think right now we have to keep evaluating what is the virus level in the communities here in Kentucky and in other states. It's really not a low risk proposition until we reach a place that the community transmission levels are at a much lower level than we are now. We've seen those numbers come down here in Kentucky and around the country. That's going to continue as vaccinations keep rolling out across the country. But at this time, I would hesitate just from a advice standpoint. I don't know that I have, again, the authority to tell you what to do on this, but I would be hesitant to approve those at this point.
I do know that the Cabinet for Health and Family Services, where the Department for Public Health lives, is we're not allowed to do any out of state travel at this point in time.
Okay. All right. The question next is, what expectations will KDE set for providing a 100% virtual school option for all students who request it for the 2021-22 school year?
I think this is a continuation of the requirement for a quality virtual school option that was contained in the governor's executive order. Once that executive order expires, the requirements around virtual school options go away. And so the decisions around what the school configuration looks like within your community is up to the superintendent, the administration, and the local board of education. I do think that because of this experience, we're likely to have strong interest from families who had a positive experience with NTI or virtual school option, that they'll want something like that to continue. So I would encourage districts to think about how they can continue to offer a virtual school option. I think that this is one of the things after COVID-19 that's going to continue going forward, is that we're going to see a diversification of school delivery options from all virtual, which is what a lot of students experienced, to hybrid models, to things where students are doing more hands-on projects in school and doing more content acquisition on their own, sort of that flipped education model. So I don't think that the virtual school experience is going back. That genie is not going back in the bottle. And I think I would encourage all of our school districts to think about how that is going to be part of your education delivery model, how that's going to be part of how school operates in your community going forward, because I think there's going to be a demand from your parents.
Okay. The next question, and again, this is kind of going back to healthy at schools. Observation, even with vaccines in place, it sounds like our healthy at school guidelines may be needed until we reach herd immunity that will allow us to not have to wear masks or social distance. Is that correct? And if so, how long should we expect it to take for Kentucky to reach that point?
Well, that's a great question that I wish I knew the answer to. And it's very similar to a question that was asked at the press conference yesterday of the governor. If you remember earlier in the vaccine, there was a lot of mathematical modeling being done, predicting where would we be in February? What would the number of deaths be? What would the number of cases be? And those mathematical models were really quite good. Then they would inject into that model, what if people wore face masks 50% of the time or 80% of the time? And those mathematical models were pretty good. Well, now we've got way too many variables for mathematical models to be very helpful. We've got cases that are going down as people have gotten better at doing the mitigation, the spacing, and the hand washing and the masks. As that happens, will people stop doing that? That's going to make the model change. We've got vaccinations. Vaccinations will change what's going to happen to that mathematical model and how we're going to see the number of cases 3, 4, and 5 months down the road. How many people will take the vaccine? Right now we're clamoring for it, but will there be a good uptake of vaccine in this community? All communities are different. Will it be different in your community versus my community? And then we haven't discussed at all today is the new variant strains. And we don't know what's going to happen. We don't know if those are going to come to Kentucky. We know we are already seeing that. And so we don't know if that's going to make our case rate go up. Getting people vaccinated as quickly as we can is the only thing that we can do at this time to try to overcome those new strains. Let's just say everybody in Kentucky was wearing their mask. Everybody in Kentucky got vaccinated. If we built a fence around Kentucky and didn't let anybody out or anybody in, we would have paradise. Many of us think Kentucky is paradise already, but that's just not going to happen. So we're going to have to see a nationwide effort and success in continuing to mitigate this violence. Well, sometimes I feel like it's violence. This virus. So I don't have an answer. I don't think anybody does. Am I hopeful that this fall is going to start looking, I'm calling it AC and BC, before COVID and after COVID? Are we going to look more AC in the fall? I am hopeful. I have no data to support that. This is just, it depends on mitigation, vaccination, and can we stay ahead of those new strains?
Thanks. One addition to that, Dr. White, COVID-19 is now a form of life on Earth, and it is not going away. What we have to do as a species is coexist with it, and the vaccine is how we're going to manage it. And continuing the healthy at schools practices that we have in place that have proven effective at mitigating the spread of the virus in schools, continuing that is going to be our primary line of defense. Now we have the vaccine in place that is providing another layer of protection from this virus, but we're going to have to live with this. So again, I think one of the things that we have to do is work with our communities to help them understand and manage the expectations that we're not going to be able to open the doors yet and everything returns to normal. The risk is going to be a lot less. The community is going to be a lot safer. The older people and the at-risk people in your communities are going to be a lot safer. Those are all great things, but we are not through this yet, and we have to keep stressing that.
I think that we're going to see that we are going to be like some of the Asian countries have been in the past, where you would see people wearing masks all the time on the street. And I personally kind of poo-pooed that when I saw that before. But I think going forward, if you don't feel well, if you feel sick, you will stay home more. I mean, 20 years of being a physician, I worked through everything. and I'm embarrassed to say some of the things that I did, which were really rather stupid, to continue working with a fever, with a whole host of medical, but that's what I was supposed to do. That can't happen anymore. That kind of ridiculous behavior. You will be wearing masks when you don't feel well. You will be staying home when you don't feel well. We are going to have to modify. So that's why AC after COVID isn't going to look like BC. It's going to be different, but it will be hopefully different. It will be definitely different than what we're living through right now.
Okay, thank you both for that. The next question is another question kind of related to this topic. Can a district bring back students 5 days a week, in parentheses, still offering full virtual for those families who want it, after staff get the second dose of vaccine, even if the 6 feet, sorry, I've lost it there, even if the 6 feet of social distancing cannot be achieved?
I feel like we're Groundhog Day with this question, Dr. White. I think we've answered it a number of times. You can offer 5 days a week with the quality virtual option. Under certain conditions, you can have less than 6 feet, but Dr. White's been clear. This should not be used as license to pack students into a room. That just increases the risk and keeps the virus going in the community and prolongs this terrible period that we've all been living through for the past year. So my recommendation is, if you've got a instructional model that complies with the Healthy at School guidance document that's working in your community right now, run that out through the rest of this year. There may be some more in-person services that you're able to add back because you have less risk to your staff now. But we've got to continue to adhere to those mitigation strategies that are in the Healthy at Schools document until we get to a different place than we are now. Dr. White, anything that you would add?
No, that's exactly what I would have said, except not quite as eloquently. So thank you.
The next question, and I'm not sure which document this is. I think it might be related to Robin, the ESSER document. But the question is, I think it was when you were talking on the ESSER. So I'm gonna attempt to, based on this statement on page 5 of the guidance document, this does not cover an expense in a district, and it was like number 15. Other activities that are necessary to maintain the operation of and continuity of services in local educational agencies and continuing to employ existing staff of the LEA. So I think they're wanting some clarity from what was being said on that.
So that is pulled directly from the Act itself. So it's not really direct guidance from KDE, it's direct guidance from the Act itself and provided by the federal government. So I think there is this expectation that overall in the ESSER Act that you will still try to maintain the complement of your staff, keep them employed, and move in that direction. So you can use ESSER funds to pay for salaries. That's part of it. And as we talked about before, we'll provide some additional information to finance officers on that. Of course, the other thing that I would just caution against is these are not funds that will last forever. So when you're anticipating paying staff and adding to your staff, remember that these funds will go away at some point. So you don't want to look up 2 years from now and you have staff that you have on board that have reached certain status, et cetera, and then you don't have the money to pay for them. So that's why the caution is about using one-time federal funds to pay for recurring expenses like salaries.
Yeah, and I think that the language that's in the federal statute on this, and that will come forward in the guidance that we have, it's intended to be broad in its use so that the funds are flexible, that you can use them in a variety of ways. I think from a value standpoint, I will keep going back to the purpose of these funds primarily should be to offset and make up for learning and experience losses that students have had over these past several months. So in your communities and as you design how you'll spend these, I really believe that the right thing to do is to think about how we can create positive, powerful, meaningful learning experiences for students over this next 2.5 years, because we know that they've missed out on a lot. They suffered a lot, and there are things that they will tell you that they need and they want going forward. If we listen to our kids in our communities, our parents in our communities, they will tell you the things that they would like you to spend these funds on. And so I think if we can listen to that and then use these funds going forward in a way that makes up for those experiences, that is a really good use of these funds and the right thing to do with them.
Okay. Just another question, clarifying, you mentioned that there were coding expenses since March and we wouldn't have to recode with the federal matching rates. She just wanted to quickly confirm that.
So that's what we're going to follow up again. It's the same question about the payroll and salaries. So I, again, encourage our finance officers to tune in. I'm reaching out to my staff right now to see if we can go ahead and get a date on your calendars so you'll know exactly when we can provide additional information.
Great. All right. And I think the rest of these two are all going to be essential for our finance officers, and we will work with Robin's office to get that communicated to you all as soon as possible. And I think that will also conclude our questions on here. Looking to see fringe benefits waived. Did we answer about the fringe benefits match being waived on ESSER 2 funds? I forget. Remind me if we have. I apologize. The question was, is it possible that we get the fringe benefits match waived on ESSER 2 funds?
That's part of the same question, Tony,
Okay.
that we'll update them through the finance officer.
Thank you. I think that concludes, Commissioner.
All right.
Teammates.
Great. Thanks, Tony. Thanks, Robin. Thanks, Dr. White. And thanks, Kelly, for being on and answering questions. The one question, Tony, I don't think we got a very clear answer on, and I apologize, everyone, for not knowing this, was that question about the out-of-state travel and what were some recommendations on that. Let's do some thinking on that and see if we can provide districts some guidance or ideas around that. I know it's a question that you're getting a lot right now, and there's a ton of pressure on you to, for again, kids that have missed out on a lot of great experiences, and they want to start planning for having positive experiences going forward. But I think we need to give some thought to that. So let us work on that and get back to you. Also make sure you put on your calendar that February 23rd date. Start thinking about how you can create these meaningful learning experiences in your community. Look at that Education Week article that Larry Ferlazzo put forth, interviewing students around what they would like to experience, what they would like to have in place over these next few months going forward. I think if we really do a good job listening to our students, listening to our teachers and educators and staff, listening to our communities about what they want us to do with these funds, we will do a good job expending them over this next 2.5 years. This is an incredible opportunity to do some great things for our kids and our community. I'm excited about what we're going to be able to do with them. We'll look forward to having all of you on here in a few weeks to talk about some plans and get some ideas from some innovative superintendents and districts in the state. Thanks, everybody. Take care.
Thank you.